Fun case, awesome guy. Walked in and was like, I don't know what's going on with my front teeth, but this has been going on from a few different years now. And I looked at him and I said, this is an aggressive case of clenching down. I mean, he clenches his teeth so hard that he has created an indent in the middle aspect of the tooth. In addition to that, he didn't like the color of his teeth, and there were some spaces, and if you see the bottom teeth, they looked slightly deformed as well. So let's move on to this side. Pretty much the flow of the edges of these teeth are pretty good. The only thing is maybe we want to increase the lengths of the front tooth slightly, but other than that, really not changing all that much, just the color, because he wanted to go a nicer, brighter color. And then on the other side, what's interesting is this tooth is angled backwards. So it actually needs to be angled in this direction, kind of following the same angulation of all of these teeth. So when I reshape that tooth, I had to think about how to reshape it so that the canine is actually in the right direction. Remember, cosmetic dentistry is not just taking on some porcelain and slapping it on. We're creating illusions that things are in certain positions that they were not from, maybe they were originally, but they were not on the day that we meet the patient. So we have to, in our minds, start thinking about it. And of course, we have a gap here. So the next thing I'm going to show you is how minimal the preparations are for a case like this. Here's what you're looking at. Patient has recession. So clearly I am not going all the way down, because here he's going to need to eventually have a graft, here as well. And how do I know that he grinds a lot, or clenches a lot rather? You see these massive indentations? This patient also needed to know that before we start, he has to commit to himself to a lifetime of night guard. And what's going on here? Now you see this is, the entire tooth is intact. We just took off a small amount to create a margin for the ceramist to know exactly where these veneers are going to slip on. And so I have no problem showing you that I knew we were creating length over here. So since I knew we were creating length, I knew we didn't need to shave this. All I did is smooth it out ever so slightly. But those things are going to be fully covered and sealed off by the final restoration, which in this case, obviously all of these are being veneered. This is where we are. What did we do? Created length in the front teeth. We got rid of that and we had a beautiful color. Here is where we are. We've now been able to seal everything off, finalize, and the exact same thing in areas that he has recession. We are keeping that area open so that in the future we will eventually do gum grafts where they need to be. Here's that canine that was slanted backwards is now actually in the right profile as well. And that space that was there before is no longer there. Now remember how that is now following the beautiful contour of the lip. And on the other side, the exact same thing. As we said, the right side was perfect. We just needed to have the color change more so than anything else on that side. And finally, remember this is where we started, those massive indents, the fracturing, the spaces, and the angulation. And this is where we finished off with getting exactly what we needed, more importantly, exceeding the patient's expectations, because he didn't know what was possible, but knew what he wanted.